Many patients are interested in non-surgical techniques to reduce down the size of the clitoris if it's too big. And when we see patients who are presenting with the medical term is clitoromegaly, or a clitoris that is too big, it's important, first of all, to evaluate and figure out, is there something in particular that's causing this? Now, in the majority of patients I see in my office, it's just their anatomy. There's nothing specifically causing this, but certain medications can bring this on. Steroids, for example, or especially anabolic steroids that bodybuilders might use, those can definitely cause it. And so obviously the first thing we want to do is stop those medications and wait some time to see if there is reversal. Other conditions such as polycystic ovarian syndrome can also cause it too. There are good medical treatments for this as well. So we'll have your doctor start those and see if there is an improvement. However, as a general rule, once the clitoris is enlarged, these medications will just stop further enlargement, or stopping the steroid will stop further enlargement. Usually there's no medications to shrink the clitoris itself once it is enlarged. I always encourage folks to wait a few months if we identify a specific thing that's causing it, see if it gets better by itself. But oftentimes this is considered an irreversible change, and the only way to change it is surgery. Now, surgery is a clitoroplasty. It's an outpatient technique. It takes me about 2 to 3 hours in the operating room. We do it on patients here in Miami from all over the world. Typically, it's about a week of work, off work afterwards, depending on your swelling, about 2 weeks of working out, and about 4 weeks off sex typically.